Good morning everybody. Today we are going to discuss about some common questions that come into the mind of those young women who are suffering from chronic kidney disease or has undergone a kidney transplantation. Dr. Vijay Sinha, Director of Nephrology and Kidney Transplantation is with us today. And sir, my first question is, can someone get pregnant after transplantation?
Yes, of course. The main of transplant in a kidney transplant program is to give the person as normal life as possible. So anybody who wishes to get transplant and after that if she wishes to get pregnant, then she can of course get pregnant.
Okay. And so second question, what may be the best time after transplantation to get pregnant?
See, as per the standard norms, we advise the patient to at least wait for 1 year after a kidney transplant to get pregnant.
Sir, what are the prerequisites for getting pregnant after transplantation?
See, any patient who wishes to get pregnant after a transplantation, there are certain prerequisites. One is that the patient should have a stable graft function. That means the creatinine should not be fluctuating, should have no proteinuria or minimal proteinuria, and the creatinine should be stable. The patient should be on minimum amount of immunosuppression, and the blood pressure and the sugar should be stable before the patient opts for a pregnancy.
Okay. So what precautions should be taken during such pregnancy?
See, these are called as high risk pregnancies. So person has to take good control of blood pressure, good control of blood sugar, should avoid all the kind of junk foods, should have a control on salt intake, and should be under regular follow-up of both obstetrician and a kidney specialist, because they are the ones who can actually see the complications coming in very early, and thus can prevent any complications.
Okay. What are the complications getting pregnant after kidney transplantation?
See, the pregnancy related complications which may happen, it may happen both to the mother as well as to the child. As far as the mother is concerned, she may have high blood pressure, she may develop a new diabetes in the pregnancy period, she can have pre-eclampsia and eclampsia. There may be incidences of proteinuria, graft dysfunction. So these are some of the complications that may happen. But if the patient is constantly under the watch of an obstetrician as well as a kidney specialist, they are the ones who can manage it before the complications arrive.
Sir, does the baby carry any risk regarding health? Shall he or she normal baby?
See, normal delivery and normal pregnancy is very much feasible in a kidney transplant patient. There are certain things that may happen. As I told you, the risks that can happen to the mother. There are certain risks to the child. The child may have intrauterine growth retardation, maybe a low birth baby is possible. And there are certain medicines which the patient is taking can have a teratogenic effect. That means the child may have some malformations. So before the patient gets pregnant, these drugs which are likely to be toxic to the child has to be stopped. That's why I told you there has to be a planned pregnancy, so that the doctor can beforehand stop all these medicines which can be problematic to the child.
Okay. So what is your message for young women undergoing kidney transplantation with reference to marriage and pregnancy?
See, the motive of a transplant is to give the patient a normal life. So for every woman who is getting a kidney transplant, we advise them to go for a normal life. In terms of marriage, they can opt for marriage. They can even opt for pregnancy once they have a stable graft function, and with all the prerequisites which I have told you are taken care of, they can have a normal child, a normal pregnancy, and a normal post-pregnancy period. So with that, I think I would suggest that everyone who is willing to conceive after transplant, they can consult their doctor and opt for it. Thank you so much.
Thank you, sir.